Hi, everyone. I'm Dr. Amy James. I'm Unity's medical director, and I want to spend a little bit of time with you today sharing some information with you about dementia and hospice care. Let's get started. What is dementia? Dementia is a progressive neurologic disorder. You may have heard about different types of dementia. Most common that you hear about is Alzheimer's type. There's also vascular dementia and Lewy body dementia, among others. Dementia is characterized by the loss of cognitive functioning. People lose the ability to think, reason, and remember. There is no known cure for dementia, but there are medications that can be used to slow the progression of the disease. How quickly the illness progresses really depends on the type of dementia someone is diagnosed with. One question people often ask is, what is it about dementia that results in people needing hospice care? Well, since dementia progresses, that progression eventually begins to interfere with a person's daily life and activities. Dementia is a terminal illness. It results in profound physical and cognitive disability. Patients over time experience total functional dependence for all of their cares. They're bedbound, their speech may be limited to fewer than 5 words, and they can have eating problems. Pneumonia and other infections are very common in the advanced stages of the disease and are highly associated with death. What is hospice? So, hospice is an insurance benefit provided to people when they are determined to be within the last 6 months of life. Hospice care is given wherever people reside. It's covered by insurance or Medicare. It helps to alleviate suffering, it promotes a peaceful death, and provides support to the family. Family members will ask, how do I know when the time is right? How do I know when my loved one is ready for hospice? Well, dementia, specifically Alzheimer's type, can be assessed using a functional assessment tool called the FAST scale, F-A-S-T. Hospice is appropriate for patients when they're in the advanced stages and when they reach a stage of 7C or greater based on that scaling tool. Patients are always, however, assessed holistically, and their other comorbid conditions, their hospitalizations, goals of care, and the type of dementia are taken into account when hospice eligibility is being determined. Caring for someone with dementia can be overwhelming, and this is where hospice can help. Getting your family member evaluated for hospice is easy. A referral can come from anyone. It can be the patient themselves, it can come from family, community advocates, your physician, even a neighbor. When that referral comes in, the hospice agency will seek input from your primary care provider, review records, and if there's a reasonable likelihood of a less than 6-month life expectancy, hospice services are offered. The goal of hospice is to provide for the patient's care in his or her home or whatever setting they call home, to avoid hospitalizations, to provide comfort as we acknowledge that the preparation for death is an affirmation of life. Hospice provides skilled nursing, certified nursing assistants, social workers, chaplains, and grief support. The team works in conjunction with the primary care provider. The team can provide education on the progression of disease so someone knows what to expect. They can help anticipate needs and are available 24/7 to answer questions and often, if needed, be present to help treat symptoms that present in the later stages of the disease. Restlessness, trouble breathing, shortness of breath, and trouble handling oral secretions, as well as loss of appetite, are all common symptoms that often need to be understood and treated. The hospice team can assist with personal cares, and they work to maintain dignity. They can provide guidance on what to expect in the last stages of life and support funeral planning. The diagnosis of dementia is frightening. but it's important to remember that each day can have joy, happiness, and remain meaningful. People need to live one day at a time, seeking the good, while at the same time attending to the practical and their necessary tasks. It's important to know that there are people, organizations, and groups that are here to help you. In the event that you have any questions about dementia and hospice care, please know that Unity is here to help. You can give us a call at 920-338-1111 or find us on the internet at unityhospice.org. Thanks. Bye-bye.